Yeah, good evening, everyone. Welcome to Lighted Red podcast series, a joint initiative by Natco and Voice of Healthcare Team. Lighted Red is a podcast platform dedicated to spreading awareness, sharing stories, and bringing hopes to the everyone who have impacted by blood cancer. As you all know, every year millions of people around the world are getting diagnosed with these conditions like leukemia, lymphoma, and myeloma. Yet too often, signs and symptoms are ignored and unnoticed. So today we have Dr. Abhijit Baheti, renowned medical oncologist and bone marrow transplant from Deenanath Mangeshkar Hospital, Pune, to understand and explore what actually blood cancer means. And also, he is with us to share his knowledge on diagnosis and treatment in blood cancer. Anyways, he is with us as we explore how multidisciplinary care and clinical research is shaping in future of blood cancer therapy. It is always honor to have you with you, sir. Thanks for coming to this platform, Light It Red. Over to you, sir. Thank you.
Thank you.
So, coming to understand and to share your expert opinion on this, what actually blood cancer. So, let us start with the basic thing, sir. Actually, what is blood cancer, and how does it different from other types of cancer?
Yeah. So basically, everyone is aware about कि what cancer क्या होता है. So cancer is like a uncontrolled growth of a particular organ. जैसे हमने सुना होगा कि ब्लड कैंसर, ब्रेस्ट कैंसर, लिवर कैंसर. सो एक ऑर्गन, हर ऑर्गन का कैंसरस प्रोसेस. सो कैंसर मतलब कोई बाहर की कोई चीज नहीं, जैसे इन्फेक्शन है, ऐसे कोई चीज नहीं, जो अपनी बॉडी के सेल से दे ग्रो इन अनकंट्रोल फैशन. सो एनी सेल ग्रो इन अनकंट्रोल फैशन दैट कॉल्ड एज अ कैंसर, लाइक अ ब्लड कैंसर. तो उसमें ब्लड के सेल्स अनकंट्रोल ग्रोथ में कन्वर्ट होते हैं. So normally we divide a cancer between two types, a simple like a solid cancer and a liquid cancer. Solid cancer मतलब like uterus cancer, breast cancer, lung cancer, and liquid cancer we normally include a call it the blood cancer. It's just for a layman terminology. We also have some kind of the lymphoma in which we get the swelling of the lymph node, which are also included in a blood cancer. So in simple term, any cancer means of uncontrolled growth. ये आपको समझना है. एंड ये अपने बॉडी के अंदर के सेल्स ही है, वही बढ़ते हैं. कोई बाहर से आने वाला इन्फेक्शन है, बाहर से कोई सेल्स नहीं आते हैं.
ठीक है सर. हाउ मेनी टाइप्स ऑफ ब्लड कैंसर आर देयर? मतलब कितने प्रकार का होता है सर ये ब्लड कैंसर?
Yeah, it's a, like a big exact number. It's a huge classification. So normally we divide the blood cancer between two types, leukemia and lymphoma. So leukemia basically is like a bone marrow involvement and the cancer from that side, and lymphoma means lymph node side. Technically, we divide the cancer into an acute pattern and a chronic pattern. So aggressive and the chronic one which are quite slow to grow and they may not like create much problem immediately. These are like other classification. And then exact scientific classification, we have that acute myeloid leukemia, acute lymphoblastic leukemia, chronic myeloid leukemia, chronic lymphoblastic leukemia, lymphocytic leukemia, then lymphoma, B cell lymphoma, T cell lymphoma, Hodgkin lymphoma, non-Hodgkin lymphoma. So they are like scientific sub-classification. For a layman, it's important कि blood cancer divided into two types. Acute means very aggressive, and chronic, which are slow to grow, and sometimes they may not require therapy also. These are the broad classification.
Okay. And who are generally at risk, sir, to develop this type of blood cancer?
So everyone, like nobody have that high or low risk. Like for few cancer, like lung cancer, liver cancer, we have the direct predisposition. Like cigarette smoking can lead to lung cancer. Alcohol may have the chances of the liver. Like for blood, there is no one-to-one causal association. There are many factors play a role, and that may lead to the conversion of blood cancer. But we don't have the any pinpoint factor that XYZ person has this thing, so he will lead to the blood cancer. Nothing like that, because once we diagnose a cancer, the many patients ask, sir, our lifestyle was very healthy, we used to do yoga, son, we used to have very healthy diet, and then why we develop the blood cancer? So the one thing ये हमें समझना है कि खाना पीना, रेडिएशन, लाइफस्टाइल, इनका बहुत ज्यादा डायरेक्ट इम्पैक्ट नहीं है ब्लड कैंसर पे. So it's not like a one to one factor, like many factors comes into play along with some genetic factor, and that lead to the conversion of cancers.
Okay, sir. So, to understand the burden, sir, next point is that what are the trends you observe in incidence of this blood cancer in India, sir?
Yeah, so साइंटिफिक डेटा, द नंबर, प्रिवेलेंस, दैट्स अ डिफरेंट बॉल गेम। बट अभी हम सुनते हैं कि काफी लोग बोलते हैं कि अरे आजकल हम बहुत ज्यादा कैंसर सुन रहे हैं, कैंसर देख रहे हैं। तो यस, number has increased, but beyond that, the most important thing is the facility has improved, diagnosis has turned up. So many patients which like used to 10-20 years back जो undiagnosed थे, जिनको समझता नहीं था क्या हुआ है, वो अभी पिकअप हो रहे हैं। काफी बार कुछ कैंसर काफी एग्रेसिव रहते हैं, तो पहले के ज़माने में या शायद 20 इयर्स बैक द अनएक्सप्लेन्ड डेथ काफ़ी कॉमन थे, वो अभी हम पिकअप कर रहे हैं कि क्या डायग्नोसिस है, इसलिए भी नंबर बढ़ रहा है। सेकंड थिंग, ट्रीटमेंट ऑप्शन बढ़ गए हैं, आउटकम अच्छा हुआ है, तो ऑटोमेटिकली प्रिवेलेंस नंबर ऑफ पेशेंट्स सफरिंग फ्रॉम अ कैंसर वो भी बढ़ रहा है कि दोज आर ऑलरेडी क्यूअर्ड, वो भी एक उसमें सुनना भी दे रहा है। तो यस, नंबर बढ़ा है, बट ये चीज़ें भी काफ़ी इंपॉर्टेंट है कि डायग्नोसिस इंप्रूव हुआ है, ट्रीटमेंट इंप्रूव हुई है, क्यूअर रेट इंप्रूव हुआ है।
सर, यू हैव डिस्कस्ड अबाउट द फैक्टर्स, आपने फैक्टर्स के बारे में डिस्कस किया, बट स्टिल इन ब्लड कैंसर मतलब विच एज, मतलब जैसे कि
सो
देयर इज एनी
देयर आर
पर्टिकुलर एज?
so as we discussed कि कैंसर की काफी टाइप्स है, ranging from that acute leukemia to chronic leukemia, lymphoma. So each cancer has a age prevalence, but it is not a strict rule. Like कि acute B lymphoblastic leukemia or T lymphoblastic leukemia we see in a childhood age group, but it is not a dictum. हम elderly में भी देखते हैं और उनमें वो ज्यादा सीरियस रहते हैं। तो childhood leukemia of B cell type which has a very high cure rate. Similarly, AML we see in elderly age group, multiple myeloma in elderly age group, but it is not always a dictum. We can see in all across the spectrum, but predominant population will be in a elderly age group in AML. For chronic leukemia like CLL, some kind of lymphoma, we see again in a fourth or fifth decade. So normally the first decade cancer in pediatric patients are normally a B cell ALL or some kind of the lymphoma, and the AML and other lymphomas are in a elderly age group or more than fourth or fifth decades.
Okay, sir. So you are talking about diagnosis as an increase. That is the reason more number of cancer patients has been detected. But how common it is delayed, sir, diagnosis from the patient perspective, or मतलब what is your point on this, sir?
तो
What
दो
contributes
चीजें
as
रहती
well?
है, दो चीजें रहती है। एक तो रिपोर्ट्स आने के बाद इधर डिले इन लाइक टू रीच द टर्शरी केयर, एंड सेकेंड थिंग एक्सेप्टेंस, कि अगर कहीं किसी ने आपको फ्लैग कर दिया कि आपको पॉसिबिलिटी ऑफ है कि ब्लड कैंसर रहेगा, तो एक्सेप्टेंस कि नहीं ये मुझे नहीं होगा, और वो डर से लोग जाते नहीं है, टेस्ट करते नहीं है, एंड उसके वजह से काफी बार डायग्नोसिस डिले होता है। ब्लड कैंसर में यूजुअली सिम्टम्स स्टार्ट वेरी अर्ली, बिकॉज हीमोग्लोबिन कम होता है, प्लेटलेट कम होते हैं, तो थकान रहती है, ब्लीडिंग की चांसेस रहते हैं, तो इसके वजह से काफी बार पेशेंट्स पिकअप हो जाते हैं, दे यूजुअली गो टू द टर्शियरी केयर। बट ये बहुत इंपॉर्टेंट है, अगर सिम्टम रहते हैं और अगर आपको कोई डॉक्टर, आपके प्रैक्टिशनर आपको रिकमेंड करते हैं कि आपको ये टेस्ट करनी है, तो उसमें डिले मत करना। जरूरी नहीं कि हर बार कैंसर ही रहेगा, कभी कभी कुछ छोटी चीजें भी रह सकती है। तो ये अपना जो टेस्ट है, ये बहुत कॉमन टेस्ट है जो हम रूटीनली करते हैं, एंड उसमें हम काफी बार ये चीजें पिकअप कर सकते हैं कि जिसमें हमें कुछ क्लू मिलता है।
ओके सर। सर, आपने अभी स्क्रीनिंग और डायग्नोसिस के बारे में क्लियरली बताया, मगर फॉर एग्जांपल एक फैमिली हिस्ट्री, एक फैमिली में एक मतलब वन पर्सन हैज गॉट कैंसर, मतलब in that particular family history, how does you, what are the screening recommendations for those who are already affected in their particular family, sir? कुछ वैसा है सर recommendations,
यस,
screening
सो क्या है ना, हर कैंसर का फैमिली प्रीडिस्पोजिशन, जेनेटिक फैक्टर इज प्ले अ रोल। लाइक फॉर एग्जांपल ब्रेस्ट कैंसर which has a very high risk of the family's cancer progression in the family, तो उसमें हम कुछ टेस्ट करते हैं, लाइक सॉलिड कैंसर में अगर उसमें वो चीज़ पॉजिटिव आती है, देन विल डू अ फैमिली स्क्रीनिंग। तो रिगार्डिंग द ब्लड कैंसर ऐसे अभी कुछ स्पेसिफिक टेस्ट अवेलेबल नहीं है, बट यस, फॉर फ्यू कैंसर हम जब पेशेंट का कुछ टेस्टिंग करते हैं तो हमें कुछ क्लू मिलते हैं कि दैट कैन बी अ जर्म लाइन म्यूटेशन, मतलब वो फैमिलियल टेंडेंसी रह सकती है। अगर ऐसे रहता है तो हम रेकमेंड करते हैं, बट एट प्रेजेंट देयर इज नो वन टू वन टेस्ट कि आपको ब्लड कैंसर आपके फैमिली में किसी को है तो हम पूरा फैमिली स्क्रीनिंग नहीं करते हैं। फ्यू कैंसर के लिए फैमिली स्क्रीनिंग रिकमेंडेड है, उस पर भी कुछ पर्टिकुलर म्यूटेशन आए तो। सो इट्स नॉट लाइक यूनिवर्सल रूल कि अगर कैंसर हुआ तो फैमिली के सबको स्क्रीनिंग करना है, ठीक है। तो ये चीज आपको आपके डॉक्टर से कंसल्ट करनी है, एंड कुछ स्पेशल सिनेरियो में ही हम वो टेस्टिंग घर में करते हैं, अगर वो डाउटफुल रहा तो। रिगार्डिंग ब्लड कैंसर अभी तक ऐसे कोई भी टेस्ट हम रेकमेंड नहीं करते हैं।
Okay. Okay, sir. Clear, sir. Very clear. And coming to treatment and matlab, if you take a last 20 years, how far it has been evolved in treatment landscape of blood cancer, sir?
Yeah, so
Treatments का क्या
significantly
है?
in last, you can say from 1990 to 2020 and 25, the treatment outcome, cure rate, and like outcomes are fantastic and improve significantly. Like people are still not believing that we can cure a blood cancer, but yes, we can cure. For few blood cancer type like Hodgkin lymphoma, pediatric B cell acute lymphoblastic leukemia, we are reaching a cure rate of 80-85%, which is much higher than the other like pneumonia and all that thing, a patient on the ICU setup. We can completely cure this patient. Yes, for few cancers, the outcomes are still very poor, but it's a very heterogeneous disorder that we have to accept, and each patient behave differently. Never compare a patient like XYZ patient had this cancer and he either improve or he the cancer worsen. Never compare your cancer, a patient's cancer, with any other patient who had a similar type of cancer also. That's very important. And outcome, treatment rate, newer medicines. Now we are getting more targeted therapy, so side effects are much lesser. So a lot of innovations are going on, and outcomes are significantly improved.
Okay, sir. Coming to treatment, sir, you said targeted therapy. Any more therapies which are getting evolved like
Yeah, so it's not all targeted immunotherapy. Then we are getting newer therapies like a CAR therapy, stem cell therapies, cellular therapies. There are sub type of the different newer modalities. So the only one term most of the layman knows is a chemotherapy. So this is a very broad spectrum. So beyond that, there are a lot of therapies are there. But for each cancer, this is different. It is like not like a universal role. Like chemotherapy is universal. For all cancer, we use word chemotherapy. But these all are immunotherapy, cell therapy, targeted therapy are different from the case to case and the cancer to cancer.
okay. And you are talking about CAR T cell therapy, sir. Is this result really promising? Uh,
Yeah, so CAR T cell therapy are the recent advances. Right now in India, it's available for commercial launch for the B cell acute lymphoblastic leukemia and some B cell non-Hodgkin lymphoma, in which just now the after commercial launch in India, it's almost like a 1.5 to 2 years. So far, data is very promising. We have to see the how the data will mature.
okay. Okay, sir. Okay. And anyways, we talked about treatment, but seeing the Indian scenario, affordability वो चीज है जो it will stands first. So
Yeah.
affordability मतलब ये जो भी है targeted therapy और बीट इम्यूनोथेरेपी जो भी है सर ये कितना अफोर्डेबल होगा पेशेंट को क्योंकि आपके सारे
Yeah.
पेशेंट्स तो टायर
Yeah, it's very important. See, we have to understand the newer therapies are definitely very costly, but if you compare with the Western world, it's still manageable in India. In India, we have a lot of support program, government funding is there. There are a lot of government schemes are there. Means the first line therapy, we can assure that nobody can deprive of therapy because of the lack of fund. There are many institutes which are offering the good services. Yes, after the relapses or refractory cases, the second line, third line therapy, when outcomes are very poor, we have a challenges. But first line therapy, first kind of therapy where we can rescue around 60-65% of patient in almost most of the blood type of blood cancer, which are available either through the government funding, crowdfunding, insurance. So that is challenge is always there, but still it's manageable.
ओके ओके एंड सर आई थिंक यू सी मोस्ट ऑफ द पेशेंट्स फ्रॉम टायर टू सिटीज मतलब उन लोगों के लिए व्हाट इज द एडवाइस यू गिव फॉर whenever they because they definitely ignore the symptoms so those set of people who are staying in tier 2 cities what kind of advice you give sir
Yeah. So first thing, the word cancer is not a death sentence. ये आपको समझना है कि कैंसर हुआ, सस्पेक्ट किया तो डरिए मत, डायग्नोस प्रॉपर कीजिए। कैंसर डायग्नोस प्रॉपर टाइम पे होता है तो उसका क्योर रेट काफी अच्छा है। सेकंड थिंग आता है कि फर्स्ट थिंग की कैंसर, सेकंड थिंग पैसा, एंड थर्ड थिंग टाइम। तो टाइम तो आपको देना ही पड़ेगा, देयर इज नो शॉर्टकट। अगर कोई शॉर्टकट देता हो तो वो गलत है, टाइम आपके लिए देना पड़ेगा। और ये अपनी लाइफ का एक, समझ लो कि आप अप्स एंड डाउन है। पैसे के बारे में हमने डिस्कस किया है कि काफ़ी कैंसर के लिए अभी काफ़ी गवर्नमेंट इनिशिएटिव्स है, देन थोड़ा प्राइवेट एनजीओज है, काफ़ी चैरिटेबल हॉस्पिटल्स है जहाँ पे ये ट्रीटमेंट के आपको काफ़ी सपोर्ट ग्रुप मिल सकते हैं। सो दैट इज नॉट वेरी इंपॉर्टेंट क्राइटेरिया। तो दो चीज़ें जो पेशेंट साइड से है कि प्रॉपर टाइम पे आपको हेल्थ केयर फैसिलिटी में आना है और डरना नहीं है। एंड सेकंड थिंग, टाइम लगने वाला है, वो टाइम मान लो कि आपकी लाइफ का एक थोड़ा सा फेज रहेगा, बट दैट विल गिव अ वेरी ब्राइट फ्यूचर।
ठीक सर, मेरा नेक्स्ट क्वेश्चन वही था, वो व्हाट वर मतलब इम्पैक्ट ऑफ साइकोसोशल इम्पैक्ट जो पेशेंट में रहता है, बिकॉज कैंसर इटसेल्फ इज नॉट related to individual but it affects entire family. So how
Yes,
does
it's
you
different.
tackle and how does you counsel? Yeah, you
Yeah,
I think you have seen across various age groups also, small
yeah.
children getting
So
ALS, as
that's
you
a
mentioned
very,
initially.
very tough job. Basically, it's very like it's a full family get disturbed. And if somebody from the main family pillar, like who's earning member, he is suffering from the cancer, then we can understand the scenario here. But yes, it's like we can't go back and change the reverse gear and see that things are there in life. We have to accept that thing and we have to move on with the hopes that there are cures are there. You can get cured, and again you have a very bright life. The future is very bright. You get cured completely from the cancer. That itself will give a lot of confidence. Yes, the first
Yes.
phase, 1 2 months, it's little challenging regarding the all aspects to accept the fact, arranging the finances, time, your job, everything. But you have to fight it. That's what we can say. And there are a lot of support groups are there in both aspects, not only the finances, like social aspects, and many institute they have this oncology social group in which you can join. There are a lot of positive things are going on around. But that the one thing that patient has to accept the fact and then have to move on. Because if you see the positivity, you can see all positive around you. If you go in negativity, why me? Why only I'm suffering? What the miss? Why it happened to me only? Then there's no answer. So we have to move on. That's the only thing we can say.
Sir, I know you have done a lot of BMTs also and a lot of treating stem cell therapy. You have done, but looking into your expertise, sir, now the things have changed. You have already explained to us, but there are enough rehabilitation centers and survivorship programs, sir, for BMT or whatever blood cancer for blood cancer patients or BMT patients.
So first thing we have to understand what is BMT. Is a bone marrow transplant is a common term we use. Basically, we use allogenic stem cell transplant or autologous stem cell transplant. And the BMT we normally perform for the some blood disorder, can be a cancer or non-cancer cases. Non-cancer cases like thalassemia, aplastic anemia, some kind of immunodeficiency, and the cancer like acute myeloid leukemia, multiple myeloma, lymphoma, few cases. So the outcome of blood bone marrow transplant has significantly improved. We are seeing very good cure rate for the aplastic anemia or thalassemia. The only hurdle is fully matched sibling or fully matched donor, which is one of the important criteria for a very good outcome. For leukemia also, in last 1 decade, the outcome has significantly improved for the haploidentical stem cell transplant. And for BMT, there's always a lot of support groups are there. And we don't need a rehab like program for the bone marrow transplant, because once patient get cured from that disease, he will like live a normal life.
Okay. Thanks for giving the confidence to the cancer patients and also the general audience, because it is already, you already mentioned it is curable. This word itself gives the confidence for the patient. But still, sir, I have lot of myths will be going on their mind. Matlab, what you have heard the biggest myth when treating the patients? One biggest myth, sir.
Yeah, that's the thing. But blood cancer, like we have that limited life and don't take for treatment. It's a wastage of money, wastage of time, and you will not get cured completely. And my XYZ relative, my XYZ friend, and that all that things. This is the worst thing which we see in practice.
Okay, sir. Okay. And for our viewers and mean to say audience, one strong powerful message for this blood cancer to create blood cancer awareness, one strong powerful message.
So
आपकी
first
तरफ से.
thing, whatever is there, accept it. It's a life and move on.
Yes.
And you are definitely going to be a winner in this game. and then you have a very future, very bright life. Right.
Thank you, sir.
A
Thank
future
you
is
very
very
much.
bright. Sure. Thank you.
Thank you very much, sir. You have touched upon each and every aspect and term of blood cancer, and you have made them understand easily what actually blood cancer and what are the treatments, what are the innovations happen in the blood cancer, and what kind of government schemes are there, what kind of support is needed. Everything you have explained, sir. And one more thing, sir, that blood cancer is curable. That is itself gives confidence to us. Thank you very much, sir. Uh, Thanks for the valuable time, sir. Thank you very much, sir.
Thank you.